A very big and a very warm welcome to each and every one of you, wherever you are in the world. And thank you for taking time out to spend the next hour or so with us on our masterclass on patient management. Now, I hope that some of you were able to join our masterclass earlier in the week on the link between COVID-19 and obesity, and you really enjoyed that session and got a lot of value from it. So today's session is all about patient satisfaction. And we know that that is so important because how satisfied your patients are really has an impact on your reputation, your credibility, and of course, that's going to impact your patient flow and create a sustainable and profitable practice for you, particularly when it comes to the Elipse program. So my name is Matthew Wright, and I am the Executive Director of Professional Education. I'm very lucky today to be joined by two of my colleagues from Allurion. So we have Dr. Ram Chaitani, who is our Chief Medical Officer and also one of the founding partners of Allurion Technologies. Also with us today, we have Whitney Sipes, who is our Vice President of Global Marketing. We're delighted and thrilled to have had input from 4 key opinion leaders. So from the world of bariatrics, we have input from Dr. Haytham Altea and also from Marcus Berry. We have on the nutrition and dietitian side, Lucy Jones, who's based in the UK. And from the world of plastic surgery and aesthetics, we have Dr. Fareed Kazem. So something really beautiful about the Elipse program is that it is a intervention that can be used across a wide range of disciplines within the medical arena. So great to see a wide spectrum of different users who are on our panel today. So what are you going to get out of today? Well, there are 3 key learning objectives. So the first one is going to be to ensure that you are able to give the best patient satisfaction for your clinic, both pre and post placement of the Elipse device. Secondly, recognizing more complicated patients and learn how to reduce their grievances. And third and finally, to find out multidisciplinary strategies to maintain high patient satisfaction and to reduce negative situations. So just to set the scene for you a little, Elipse already has incredibly high patient satisfaction, and this is reflected in some of the metrics I'm going to talk to you about now. So first of all, we are delivering 100% growth year over year for the last 3 years, and we are absolutely planning to maintain this hyper growth rate post COVID-19. And as a team, and I'm sure you as partners are very pleased to know, is that we now occupy the space as the world's best-selling gastric balloon. In July 2020, our sales were 4 times the size in July 2019. So that's incredible exponential growth. And our website traffic has tripled in 2020 versus 2019. And we are committed to fueling this growth by investing 3 times more in online advertising. And really, as an organization, ethics, transparency, patient safety is really at the heart and the core of everything we do, which is why we've set up this webinar to really help best practice sharing across the globe. So I have the pleasure now to hand over to our Chief Medical Officer and founding partner, Dr. Ram Chaitani, who is going to talk you through the latest in clinical data around efficacy and safety.
Thank you so much, Matt. I really appreciate all of you attending. We've got a huge audience today. And I'll focus on the clinical aspects and try and share with you aspects that you are going to find very useful. But before that, I think it's important to understand that our balloon has a tremendous amount of scientific data now to back it up. And most importantly, published the largest multi-center study with Elipse with 1,770 patients participating. But more importantly, this study was done in 19 different countries and it really included patients that had a widely diverse geographic situation, cultural, ethnic, and dietary habits. And so the results are much more meaningful and can be applied much better across the entire globe. Uh, in this study, they were able to show a 14.2% total body weight loss, which compares really well with longer duration endoscopic gastric balloons. The Elipse system also enables much wider application of the gastric balloon technology by the sheer fact that it does not require endoscopy for placement or for removal. And finally, it showed that small bowel obstructions, which occurred in 2016 with an earlier version of the device, were eliminated in this study once the newer version of the device that was used in this study, which is currently available commercially. And that's really been our experience worldwide right now. With that, let me hand it back to Matt for the next section.
Thank you, Ram. So we are going to look at perspectives of one of our newest customers. So we introduced Dr. Farid Kazem at the beginning of our webinar, and he has recently added Elipse to his clinical offering. And he has had a very successful entry into this new product category, but he has had to adapt his clinic to maintain patient satisfaction. And really, he's very passionate to share with all of you today some of the teething problems that he's had to overcome and really the best solutions to really ramp up to productivity as soon as possible. So let's hear directly from the man himself.
Okay, so my name is Farid Kazem. I'm a plastic surgeon in the Netherlands. I've been practicing for over 28 years. We do lots of non-invasive procedures like cool sculpting, like thermage, like Botox fillers, all of that. And recently we started doing or integrating the Elipse balloon into our practice. We started doing the Elipse, I think, now 1 year ago. Then we set the whole thing up. In our practice, we had to find the right dietitian, the right setup, and once all was set up, which went very, very fast, we started doing our first 5 placements, which went very good. And if we look now, I think we've done over 25 placements in the whole. I think we did pretty well. If I look at the average of the loss, I think it's between 14 and 15 kilos. That's our average, with our highest is 19 kilos, which is very, very good. But recently we also discovered the other side of the whole experience, which is we had 2 cases that were related to each other. They were sister-in-law, and they really did not understand the concept. They made each other really crazy during the whole process, and we had to remove the device just 3 weeks before the scheduled ending of the whole procedure. But we learned, I think, a lot from this experience, and I think I can share some of that with the audience in this masterclass to discuss these small tips and tricks so that first of all, I don't want to experience this again, and if I can help someone else who's starting to do this, I'll be very, very happy to do it so that they start in a higher level even in their learning curve. But as again, I accept the fact that because it was new to us, this is our learning curve.
So before we go back over to Dr. Ramchitani, I'd just like to point out that the whole of this webinar is to help you learn. So if you have any questions that you would like us to answer, please use the Q&A function, which is at the bottom center part of your Zoom window, to pose questions to Dr. Chitani. We will be spending some time at the end of the webinar presentation to answer your questions. We have had a lot of questions on previous sessions, so if we don't get around to answering your question on the webinar, we'll make sure to make contact with you directly to answer any queries you have. Ram, back over to you.
Thank you, Matt. So one of the key things for a satisfied patient is to take steps pre-placement of the Elipse balloon, because it's going to impact the entire journey that the patient is going to experience. So what can we do to lay the foundations for a good patient experience? The first thing, of course, is that we want to make sure that these patients meet the instruction for use criteria. Communication. It is so important to ensure open communication channels with the patient, and especially the patients who have doubts, who have questions, to establish this early, before the patient even gets the balloon. Spend time with them to establish these communication channels. Finally, we send them emails. The patient information pack, which you see on the right side of this slide, is beautiful, and it's extensive and in detail. And our marketing team has spent a lot of time trying to answer every question that the patient may have. So do try and send this to them 1 to 2 weeks in advance. And finally, watch for signs for patients who are panicking or who are afraid or who may not be ready as yet. And that will always happen. They're nervous about the procedure. They have doubts. So do spend the additional time with these patients. This time is going to be extremely valuable for the overall patient experience. And if they seem nervous about the procedure, reassure them. But also important at this time to not coerce the patient. No, don't force the patient. It's the patient who's getting the balloon. And it's really important that you don't push them into getting a balloon, because then I can guarantee you the experience is not going to be good for the patient. So let the patient make the decision, answer their questions, reassure them, but do not coerce them or force them. So what are the other roles that the physician has in the pre-placement? It's very important that the patient have an acute understanding, a detailed understanding of what they are going to go through. So make sure they completely understand, but not just understand, they should acknowledge all the information you are giving them. There are times when the patient is sitting there but not registering the information. So quiz the patient. Do they understand? And do they have any doubts? What did you tell them? Give them the details of the procedure. Very important to talk to them about a few things that are on their minds. The biggest one is their worry about difficulty with swallowing. Reassure the patients that even if they are unable to swallow, there's a follow-up procedure with the stylet, and they're not alone in their thinking that they wouldn't be able to swallow this capsule. And with that stylet, 99.9% of patients will be able to get the device in. Reassure them about that. They have worries about side effects. The first days may be hard, and it is most important, but to emphasize that most of these patients will improve in 48 hours, and almost all of them will be symptom-free by 1 week. So acknowledge to them that they will have difficult symptoms. That is very important for them to understand that before they proceed ahead. Don't put them at so much ease that when the symptoms occur, they get very worried about it. Tell them that they will have symptoms, but you will manage the symptoms. Also very important is to make sure they have realistic weight loss goals. There are patients who may be coming to you who may be thinking they're going to lose 50 kilograms, and that's not realistic. So give them the statistics, tell them the amount of weight loss they should expect, 10 to 15% of the total body weight. Explain to them how much that would mean for them. But explain to them that some people may not lose that much weight and others may lose much more weight. So realistic weight loss goals is very important for a satisfied patient. And also very important to emphasize to them that the goal of our balloon is not weight loss. What the goal of our balloon is to help them understand and recognize the feeling of satiety. The goal of our balloon is for them to understand when the balloon is there, what it feels like to be full, and recognize that. And once they recognize them, that's when they'll be able to sustain that weight loss even after the balloon has passed. This is very important. What we are trying to achieve with our balloon in those 4 months is a change in behavior, a change in behavior. And it's really important to keep emphasizing that, that having them understand that they need to recognize the feeling of fullness, the feeling of satiety. The level of the patient's understanding pre-procedure will increase the patient's satisfaction in the days and weeks following the procedure. And as you know, we've done a very extensive study looking at the biggest barriers for Elipse. And these were a fear of possible side effects, possibly having pain, and like I mentioned, a fear of swallowing. So make sure you address all 3 of these before the procedure is actually done. So let's move on to Matt. Matt, did I miss a slide? Let me just...
No, we're good.
Okay, sorry. Matt, and Matt will discuss more with you about the role of the nutritionist.
Thank you, Ram. So the role of the nutritionist is really crucial and all the way throughout the journey. In terms of pre-placement, the nutritionist spending time with the patient can really help to set up good behaviors and really build a base for future success all the way through the Elipse program. So one of the things that the dietitian is going to be able to do is contextualize symptoms and reduce panic around those symptoms, particularly what the patient will experience in the first week, and really start the wheels in motion in terms of affecting that long-term behavior change around learning new eating patterns. So this is all key to having a satisfied patient. So let's hear from our KOL nutritionist, Lucy Jones, to discover more about this topic.
My preference for the first appointment is for it to occur actually ideally a couple of weeks before placement. I don't always have that luxury. Sometimes it ends up a couple of days if it's been a short turnaround, but I very much like to speak to them beforehand. One, just so that you can contextualize the symptoms that they'll get in the first days. Otherwise, people can have quite a lot of fear and panic about the symptoms that they get because they don't understand that it's normal. So I'm pretty honest and abrupt when I'm talking to them about those symptoms in the first couple of days. I use words like the cramps feel like gastric flu. They make you feel quite shivery. And some people with the nausea, it can be so bad that they vomit a lot. And all of that is normal. And the reason I'm telling you that is not to scare you. It's so if it happens, you know it's normal and it's going to settle down. And your job is to keep yourself sane and to keep yourself hydrated and to wait for that day or two until they start settling down. And again, that can take down a lot of this reactive panic that you can get from people in the first few days if they understand that it can be a pretty rough, stormy sea for the first day or two. So yes, the seeing them beforehand is very useful for reducing fear and panic. The other reason I like it to be a few weeks beforehand is I get them to start doing the groundwork on changing their eating behavior before placement. So what you tend to see is if somebody is continuing to get symptoms beyond that first week, very rarely is it true balloon intolerance, although we'll come on to that. actually it's normally a maladaptive eating behavior. They're either eating too fast or they're eating too much. Normally, if you just get somebody to halve the volume of what they're eating and slow right down, the symptoms settle down. And if you can get somebody to start practicing that before placement, usually you very much reduce the frequency or the duration of the symptoms that they get afterwards. So I'm getting them to try and pace at about a mouthful per minute, with the key indicator that once they've swallowed, what they're trying to do is to give enough time for the mouthful of food to work its way down their throat, their esophagus, hit their stomach, and they're looking for a sign of satiety. So that might be a slight tightness in the chest, it might be a feeling of bloating or distension, or it might be that they start to get sensations of trapped air, so hiccups or burps. And the minute that they're getting any of those, that's the time to stop. And if they stop at that point, usually they won't push themselves to the point of getting reflux, nausea, or pain or sickness. And if you have a week or two before placement to embed that, really helps a lot.
So some great advice from Lucy there to immediately start really dialing down the symptoms in the first week and setting up behaviour change in the long term. Another really key thing for the dietitian to do is to carefully understand the history of the patient in relation to food. So what main challenges do they face? Why do they use food other than simply being hungry? And what are their challenges with weight loss and diet up until this point? We know that many people who are searching for medical weight loss solutions have tried and failed multiple times with diet and exercise. And by helping the patient build up their coping toolkit, you're really going to help them to reach their weight loss goal. So on this topic of understanding the history of the patient before setting out a plan, let's go back to Lucy to hear her tips.
And it's something that I do look out for a lot when we're taking a weight history, when we're looking at goals and motivation, and when we're taking an initial diet history to understand how food fits into their life. And one of the key things that I end a diet history on is really reflecting, getting them to reflect back. What do they think are the main challenges or issues within their diet? What do they think we need to work on? Are they just somebody that likes big portions and is used to eating big portions? Or do they use food for reasons other than hunger? Is it playing a role in comforting them when they've got low mood or when they're stressed? Is it playing a reward? A lot of people use food as a reward and a treat for getting to the end of the day. And tapping into the role that food is playing is really key in us understanding that as a potential barrier to change and something that can trip them up. Because, of course, essentially, if we don't tackle those things, the ellipse just becomes a band-aid like anything else. And the minute you take it off, there's the chance that those behaviours and that tendency to use food for those reasons will always be there. So one of the key things you're then trying to do during the ellipse placement is to build up that coping toolkit, to build up other measures that they can do to self-soothe, to treat, to reward. And sometimes people just need help with coming up of ideas. What can they do when they're feeling low that isn't food? And then they need some headspace to actually practice those. Practice them when they don't need them. And the more you practice them, the more chance that you will be able to call on them when you really need them.
So some more great tips there from Lucy. If you do have any questions specific to nutrition, we have our Executive Director of Sales, Camillo Docimo, who is in the webinar with us, who is able to answer your questions in the Q&A section. So please don't be shy and reach out. So in terms of preparation, I just wanted to touch on the role of a psychologist. And for some of you, this may be the first time that you've heard us talk about a psychologist in relation to the Elipse program. And don't get me wrong, we see a huge amount of patients and clinics who are incredibly successful with weight loss and patient satisfaction through the core team of a physician and a nutritionist. However, with some of the specialist bariatric centres we work with across the globe, it's common practice to include a psychologist in the support. And many patients do extremely well when you have this multidisciplinary approach, thinking about the psychology, but also the physicality of the food that you're eating with your nutritionist. So it's not something that is mandatory with the Elipse program, but it's something for you to consider. If you identify a patient who has had a history of difficult relationships with food and a complex background, then this is an area where you may think about bringing in a psychologist for assistance. So as I say, not essential, but it's something that can be a great tool to use with the right patients. So we've covered pre-placement. So at this point, I'd like to hand back to Dr. Chitani, who's going to talk to us about post-placement and some of the practices that we can employ to ensure patient satisfaction after the balloon has been placed.
Thank you, Matt. So let's move on to post-placement practices and what we can do there to maintain and improve the patient satisfaction. So as we have discussed, the first week is the most important in terms of the symptoms that the patient will be feeling. And that's where your engagement with the patient will be the most important and most taxing. So the first week often is the most difficult as the patients adapt to the balloon. And they have to overcome symptoms and adapt to a life with the balloon, both physically as well as psychologically. And remember that all patients are different. And their symptoms can range from being completely asymptomatic to mild nausea to intense cramps and vomiting. So you must put a system in place that applies to everybody because every one of them is different. And in fact, some of the big complaints we get are patients who are asymptomatic and they think that the balloon is not working. And this must be set up in the expectations part before the placement. So they understand that they may be patients that they may not have any symptoms, but they will still feel the satiety, they will still lose the weight, and they should not worry. One of the important things that we have recently discovered is that we are changing our recommendation for Buscopan. As you know, Buscopan is a smooth muscle relaxant, and most surgeons give that routinely after a bariatric surgery because they don't want the stomach to contract since it's had surgery. But with balloons, having Buscopan as a standard treatment is not effective and actually can be quite detrimental. So remember, when the patient gets the balloon, the patient has slowing of the gastric motility. Immediately, there is a delay in gastric emptying. And if on top of that, the patient gets Buscopan, the patient may have significant and severe dilation of their stomach. And in fact, their intolerance symptoms can actually worsen. And we have seen that over and over again. So we now say, do not give Buscopan routinely. Give it only if it is needed for severe cramps associated with nausea and vomiting. So very important to realize that cramps can come from two opposing methods. One is the cramps from intolerance. So you are advancing the diet from liquids to full liquids, and the patient starts having cramps, but associated with cramps are nausea and vomiting. In that situation, you need to revert back to a liquid diet. And if the cramps are really severe, that's when you may give Buscopan. On the other hand, when you're advancing this diet, when around day 2 or day 3, the patient starts having cramps, but at this time, the cramps are not associated with nausea or vomiting. What are those cramps coming from? Those cramps are coming from hunger. These are called hunger cramps, as Cam, who's on the call right now, has pointed out to all of us, that when these patients have these hunger cramps, actually it is better to advance the diet rather than go back to a liquid diet. So at that point, you would advance them to a solid diet for these cramps. So these are cramps without nausea, without vomiting, and these are coming from hunger. So you have to do diametrically opposite things depending on what sort of cramps you are dealing with. So very important to understand that. And it's only over some time recently that I've come to understand that. And that's why we are now taking out the recommendation of giving Buscopan routinely. Give it only if it is needed, and and evaluate these cramps smoothly. So to improve patient satisfaction by being proactive during week 1, you will also reduce their anxiety and reassure the patients, which will really play into the eventual satisfaction that the patient will get. So at this point, I'd like to introduce Dr. Haytham, who has placed over 2,000 balloons, one of the largest experiences in the world, and has a tremendous understanding of how to deal with patients. So let's have Dr. Haytham talk.
Clinics in Denmark and Sweden, actually, we have two numbers. The normal telephone number they call for dietitian, for the coordinator, for everything else, and they have the direct acute number. And when they call the acute number in Denmark, I have the number directly. I will answer them by myself. In Sweden, I have my colleague, Dr. Ali, that will take the telephone and answer them. So we have actually direct contact to the physician or the surgeon. Because it's acute, we should find out what the problem to manage it if it is really acute. And most of them are not acute, actually. Yeah. Types of personnel. In this case, we have the dietitian that will follow up, make the follow up the patient weight loss, and also if they have any problem with overeating like that. And we have also the coordinator, or what we call the receptionist. They call them in Denmark. We do that. We call them all together next day. After 24 hours, we call all patients, ask how they're doing and if they have any problem. And we make in our calendar, we make some sign like red color like that if they still have some symptom. And we call them the second day, third day, until the patient tell us that everything's okay. We remove this color. That means if I put 10 balloons, maybe 3 of them, they will tell us that that's difficult. They have symptom, nausea, vomiting, and so we tell them, okay, do like that, and we call you again tomorrow, and tell you next day, the same next day, until they get better. So we feel actually we did that 2 years ago, and we're still doing that. We feel that will help a lot to avoid acute calling us, and that's give also assurance for the patient that we care about them.
Thank you so much, Dr. Haytham. That was absolutely great advice for everybody on this masterclass. So now everybody, let's take a look at patient communication while a patient is outside of your clinic. Remember that not only does Allurion provide your patients the Elipse balloon, but Allurion also provides the full Allurion weight loss program with digital support. Please remember to have each and every one of your patients download the Allurion digital app and connect their digital app with the Allurion Bluetooth body composition scale. Data has shown that patients that weigh themselves more often are more likely to achieve success, and it can help keep that patient on target if you're having them send your clinic their weight loss success on a weekly basis, and they can easily do that directly from their Allurion app. Also, just some quick tips to help set your clinic up for success. Having an in-clinic Elipse coordinator can really help with follow-up and be the point of contact for your patients. And also, we really recommend, like you heard Dr. Haytham speak to, that you have a red flag or a no-show Elipse system in place. Meaning, for example, maybe a patient doesn't come to an appointment or a follow-up. Maybe they were a little embarrassed that they haven't achieved their weight loss goals, so they skip a meeting. Please make sure that someone at your clinic is following up with those patients, and you have a process for that. Really, without a patient's weight loss feedback, you cannot guarantee patient satisfaction when they pass the balloon. So now let's hear from key opinion leader, Dr. Marcos Berry, from Chile.
Yes, it's very important to be clear with the patient that they have to report their weight on a weekly basis to our team. And our team for follow-up is the coordinator during the first 4 weeks and after that, our dietitian from our medical center. And they report to them also on a weekly basis. We do have some flags, red flags, that raise up when the patient is not sending the report, or worse than that, if we see that they're not losing weight as we would like to. So in those cases, we do call them and ask them to come for a formal visit with a physician. And I think for a aesthetic clinic or small clinic that is going to focus only on Elipse, they should be calling on a weekly basis. Also, they have to bring the patient during the last month for a close follow-up and assess them, how they're doing. And they should consider other treatment, medical treatment or medication treatments as needed. I think that's very important. It's not a failure of the balloon. It's the only thing you want to teach and to educate the patient is going to do better, or going to improve the results if we add other modalities as medications, for example.
Those were great tips and information for everyone to be successful. Thank you so much, Dr. Berry. So again, everybody remember the supporting tools from Allurion. Again, the Bluetooth connected body composition scale and the digital app, where a patient can send you their results for progress tracking. And as Dr. Berry recommended, on a weekly basis is ideal. And this is also going to help patients have greater involvement in their overall experience. And it's going to allow them to be able to visualize their weight loss success over time. Additionally, Allurion also provides clinics with additional support for consultations, especially during this time of pandemic, where maybe your patients don't want to come into the clinic as much. So we provide our clinics Zoom for Healthcare, and you can utilize this to help support a greater frequency of checkups and follow-ups. So if you're interested in this, please contact your Allurion field sales representative. So now I'm going to turn it back over to Dr. Ram Shatani to discuss what to do in the off chance that a patient may want to have their Elipse balloon removed.
Thank you, Whitney. So there are many questions coming up in the Q&A, and some of these I am going to address during this presentation, and the others I'll address after the presentation is over. So what do you do if a patient wants to remove the balloon? Remember that the majority of patients are satisfied with the Elipse treatment. However, some patients require reassurance. So it's important, as Dr. Haytham mentioned, to create a line of communication. They must feel comfortable with that communication line. And I really like his idea in the Nordics clinics where they have two separate lines, one line for regular routine follow-up and one for an urgent follow-up, which directly goes to the physician. So very, very good idea. And I think we can all learn from that. So important to talk to the patient and understand, A, do they have physical side effects? Or B, they are just worrying because they have a foreign object inside them for 16 weeks and it's just the anxiety that's playing a much bigger role. So you can only know that once you talk to the patient. And then reassure the patients by creating a constant daily communication until the patient is calmer and the symptoms have resolved. Elipse is a well-demonstrated, safe, and effective tool for weight loss. Make sure you reiterate that. Share with them the clinical data about the safety of the Elipse balloon. Also, it is important for them to know that the symptoms that they're having in the early days are normal and they will pass. So reassure them about that. And to take each day at a time and not think about the next month or the month after, just a day at a time, and it's very helpful. And especially for patients who are extremely anxious and nothing seems to be getting through, it's a very good idea to involve a local psychologist to guide them in their management. So let's hear again from the Nordic Clinic's experience with Dr. Haytham.
if that this thing happened for them, and if that this thing happened for them and they get panic, or they want to remove the balloon, so we try to work with them to accept the balloon, because some of them, they don't accept as a foreign body in their body, so they just want to remove it because they are afraid something will happen. And if you ask them about symptom, nausea, vomiting, pain, they don't have, but they don't want the balloon. That's that. So we try to manage it by talking to them, and if we go through this step with the first couple of days and they get better. I remember actually a patient that get a balloon 3 weeks ago. She called maybe 2 times per hour because she afraid, and actually take a lot of time to talk with her, and finally she have her Elipse until now, and she's happy. But sometimes people are different. Most of them, they get a balloon, we never hear from them until the balloon out, and they told us, I lost 20 kilos. And some of them, they call every hour, every second hour, just to be sure that everything is okay. And so that's normal.
So I think this is a time we need to understand, as some of the questions are coming, what to do when patient has side effects after the 2nd week or 3rd week. So remember, the symptoms in the 1st week are normal. But there are 2 groups of patients I'd like to address with you. The first group of patients are who never get through their symptoms. And this is very rare, but these are patients who continue to have discomfort. So their symptoms will improve a little bit, and then they'll get worse. Then they improve for a few days, and then they get worse. And this continues on for weeks and months on end. And this is a condition called persistent intolerance. It occurs very rarely, but what happens in these patients is that the balloon causes, as you know, in all cases, a significant decrease in gastric motility. But in this group of patients, that never recovers to normal. It persists. So they start eating less, it gets a little bit better, but then again, the dysmotility persists. And in these cases, unfortunately, the only treatment that may be there is to get the balloon removed. You can try some of the things that Lucy pointed out, eating very small amounts and see if that makes a difference, or changing the diet. But in this rare group of patients, often the balloon will need to come out. Then there's the other group of patients who have completely improved after the 1st week, and they are doing great. And then they have a sudden onset of symptoms 2 months after the balloon has been placed. What do we do over there? It is very important that in this group of patients, we must intervene and understand what is happening with them. And that can only be done by bringing them back to the clinic, getting them started with intravenous fluids quickly to get them hydrated and feeling better, checking the balloon with ultrasound to make sure it's fully inflated. If need be, you need to get blood tests, gastroscopy, and even a CT scan to check if everything is normal. Now, once you have checked all that, if everything is normal and there are no complications, we can certainly continue to manage those patients medically by moving their diet for a week or so back to a liquid diet and then advancing that again. But if you have tried all these techniques to convince the patient to keep the balloon, but the patient is insisting that the balloon needs to be removed, be respectful of the patient and organize for that balloon to be removed so that they have trust in you, and they'll go on the internet and write in the social media that you gave them respect, and even though they couldn't tolerate the balloon, the satisfaction of that patient will still be maintained. So there were questions that Adil had what do you do patients who complain that they cannot feel the balloon? So let's give different scenarios on how to manage it. The first is some patients report that they can't feel the balloon after 1 or 2 months. The first thing to check here is, are they continuing to lose weight? And if the weight loss is continuing or near their goal, it is important that even if they don't feel the balloon, reassure them that's quite normal and not to worry about it, and nothing more may need to be done. Then there are some patients that report that they can't feel the balloon after 1 or 2 months, but they have stopped losing weight also. And ask these patients to come into the clinic, do an ultrasound to check if the balloon is in the right position and the right size and hasn't deflated. And once you confirm, then you can refer them to a dietitian for a more intense follow-up. But also, if you do the ultrasound and find that the balloon is not there, this happens very rarely, that the balloon may pass early, but we as a company stand behind our balloon. And that if you confirm that the balloon has passed before 3 months, we will replace that balloon. Once you have confirmed that, we will replace that balloon free of charge to the patient. Then there are some patients that report that they cannot feel the balloon after 3 months. And at that point, we check if they have reached their weight loss goals. And if they have not reached their weight loss goals, we manage them with enhanced dietary support. And this is the time when you may add other medications, you may try other methods like ketogenic diet and other ways to improve their weight loss journey. So these are the 3 groups of patients you may deal with, and I've described to you how we would manage those patients. So, okay. So let's talk about other patient scenario. And this is one physician's experience. And these can be patients who have completely unrealistic expectations about their weight loss. We must remind them that the average weight loss is 10 to 15% total body weight loss, and calculate for the patients what it really means to them. Mention to them that Elipse is not a magic bullet. Patients need to modify their own behavior to be successful. And what we are trying to achieve, and keep reiterating that, what we are trying to achieve is really a behavior change. So we can have sustained weight loss even after the balloon has passed. And that will lead to the most satisfied patients that you will have. And patients who are not losing weight and ignore to contact the clinic, what do we do there? We ask them to come to the clinic. It's very important. And remember, there will be some patients who don't contact you because they're embarrassed that they're not losing weight. Reassure these patients that there's nothing to be embarrassed about, and offer them the different solutions I just mentioned, and work with experts to find the right solution for them. So let's hear from Dr. Marcos Berry on how he approaches these patients.
I think there are 2 groups. One is the group that has completely false expectations or very unreal expectations about the weight loss. And they think that they're going to lose 25, 30 kilos. And I tell them they're not going to lose that. Or it's very unreal to think that you're going to lose that. So I always give an estimate based on their weight at the beginning. And usually is about 14% of their current weight loss, current weight. And in those cases, I always tell them, for example, if you are 100 kilos, I said you're going to lose approximately 15 kilos. It can be 10, or it can be 20, but the average is 15. So I give a range. That's one group. That also, what I do with them, I always follow up them about 2nd or 3rd week after the placement. And I tell them, if you're going to lose, for example, 10 kilos during the first month, you're going to end up losing about 20. So I give the rule of double the first month is going to be the weight loss. So I encourage them to do their best during the first month. But that patient that are not losing that as they would like to is a particular group, but I give very clear the expectation. The other group is the group that they're not losing weight and start hiding. So they don't want to send their report. They're like ashamed, and you call them, they don't answer your phone calls. And that's a difficult group because you cannot reach them. They're kind of unhappy, but they don't want to fix anything.
Thank you, Ram. So it's not just physicians who are dealing with unsatisfied patients. Obviously, our nutritionists are in constant contact with the patients after placement, and they have an experience as well. So we see two main groups who are unsatisfied and have conversations with their dietitian. So first of all, is quite a rare group, which is patients who need to have the balloon removed. And as Dr. Chitani was telling us, this isn't very often the case. But what we do in this case is to ensure that we continue to offer the nutritionist follow-up for the full duration of the program. This patient has paid for the program, and also we can really use this time to affect behavior change and to really help to reduce weight. The second group is the more common group of unsatisfied patients, and this is where they complain about a lack of satiety. So they're just not feeling full while the balloon is in the stomach. And there are 4 things that we can really do to fix that. So things like increasing more solid or dense textures into the diet, increasing the amount of low energy but dense foods to help manage hunger. Fiber supplements are really, really helpful because obviously they make you feel full up. And then we can also consider some adjunct therapies such as Saxenda, or to look at a secondary diet plan. And Dr. Chitani just mentioned things like low-calorie ketogenic diet, intermittent fasting. These are the kind of things that we can look at to really accelerate the weight loss. So it's important really to remain responsive, to be proactive in communicating with the patients and really having frequent follow-up. So let's go back to Lucy Jones to hear what she has to say on this subject.
Sorts of disgruntled patients that I have experienced with an Elipse. You get the true balloon intolerance where the symptoms go on past the first few days, they're severe, a patient is at risk of dehydration, or somebody has ongoing really bad reflux and bloating and they're unable to tolerate solids. The first step that we do, I don't know how evidence-based this is, but oh my gosh, it works so much, is we get them to drink a pint of fizzy water and jump up and down for a minute or two, see if you can move the balloon. Because sometimes if the balloon gets lodged over the outlet hole, it creates a lot of discomfort for the patient. So actually, we'll always try that because you're not going to lose anything by trying it. And for an incredible number of patients, we get a good resolution of symptoms. If the symptoms are continuing, you've tried moving the balloon, either by manual massage or by fizzy water and jumping up and down, things aren't getting better. You've got a decision to make. You're either going to put up with symptoms if you can keep that patient safe. And I have had a patient that has chosen to do meal replacement products as a form of nutrition because they were so keen not to have their balloon out, or it's balloon removal. And what we tend to do at our clinic to try and reduce patient unhappiness at that point is that they will continue to work with me afterwards. After all, they have paid for a package of care. So we continue the diet therapy, I continue coaching them, and we continue the work just without the balloon because the balloon was making them physically unwell. But let's be honest, those cases are few and far between. Most people can tolerate that balloon if we get the eating behavior right. So a lot of it is down to checking in with pace, with volumes, and it might be that I need to provide them a set plan to follow. Your next set are the ones that were expecting the magic wand and they didn't get it. They're either hungry or they're just not losing good amount of weight. Now, these are much more frequent, and you find satiety with the balloon is variable. Some people get overtly full with it and barely eat a thing. Other people feel very minimal difference, and that might just be down to individual anatomy of the impact that balloon's having. So again, we might try moving the balloon just in case that helps. I focus on specific dietary advice where I'm increasing the solid, dense textures of meals because they tend to make people feel much more full. We'll look at different timings so you can increase the frequency that somebody's eating to try and manage hunger. But you obviously will stick to very low energy density foods to not cause weight gain. So that's where somebody will need quite a set plan to follow. Some people like to trial a fiber supplement like glucomannan or konjac to see if they can enhance the feeling of satiety with their balloon there. And if it's just weight loss, actually, I think we need to recognize the potential role of adjunct therapies while somebody's got an ellipse. If they have a diet plan, they're following that, but we're not getting good weight loss despite the balloon in place, that's where I might be looking at adding another diet therapy, be that something like intermittent fasting or a low energy diet. It might be that you start to look at medication adjuncts, so things like Saxenda, so that you can try and get somebody a better outcome overall.
So some really good tips there from Lucy. Now, we also have to think about post-ellipse. How do we empower the patient to continue the new behaviours that they've learned during the period that the balloon has been in the stomach? And this is really about building accountability with the patient right from day one. So remember, Lucy talked about meeting with the patient a couple of weeks before the actual placement day, if that's possible. And really setting the expectation that ongoing changes to lifestyle are absolutely essential, and that the balloon is acting as a catalyst for the weight loss, and the balloon will help you to get there faster and to get you further than if you just did diet and exercise alone, but it won't make you lose the weight without other changes. So beyond ellipse, after it's passed, we really need to think about predictable behaviors, having a rhythm of how you eat, having smaller volumes of meals and having good portion control, maintaining behavior change after the balloon passes. And really, we try not to encourage anything in the 16-week period that isn't sustainable in the long term, because that is not going to be an effective way to change behavior that will stick with the patient and ensure that they keep the weight off once the balloon has passed. So for the final time, let's go back to Lucy to hear what her tips are on this topic.
So following that, I spend a lot of time in that initial appointment setting what we're trying to do within this 4 months. And the way I tend to position that with patients is that we are trying to create a very predictable rhythm in behavior. So I'm getting people to eat at the same times, have the same repertoire of meals. The balloon is helping them to get used to eating a much smaller volume of meals. And overall, their body adapts to this and gets used to it, with the end goal that when the balloon comes out, you're changing as minimal as possible. So you're sticking to the same meal times, the same repertoire, as close as you can to the volumes that you were eating, because it's not like a light switch turns off and they're suddenly starving. They're not, actually. They're pretty empowered then to keep it going. And again, that really helps you to position that this isn't a diet. And I'm quite clear that I don't want them to do anything in that 4 months that they can't reasonably imagine they can keep going with long term. So this is not a time to strip yourself back to just a liquid diet for 4 months to get the weight loss off, because actually that doesn't set us up for the future. What we're trying to do is to find the rhythm and approach and the meal choices and the timings that work for them in their life. And that's our overall goal. And I think that's a very useful positioning for them to understand what the key outcome of this, and it stops that fixation of the balloon isn't doing enough, the balloon isn't stopping me eating.
So we would like to have some closing remarks before we wrap up and answer your questions from Dr. Farid Kazem. So a big thank you to Dr. Kazem for really sharing his journey as a new clinic to Elipse. And as he said in his video at the beginning of the webinar, that he's been on his own learning curve. But here are some insights he wanted to share with other clinics to help accelerate their speed to success.
I think mainly I'll never do a whole family situation like this. like 4 of them. I think the maximum would be husband and wife or 2 sisters. But then it will be more of a one-on-one consultation to try and see what the real motivation is of the person itself and what they want. I would emphasize the journey. I would emphasize the ups and downs and the fact, I mean, actually, this example that I've had, I'm using it now with all my consultations for the balloon. So I tell them that I had these 2 people, without naming names, what I had with them and how I got fed up at the end and just removed it, just to emphasize that there is a situation where if the mind is not working the right way, that this can fail, and not because the system fails, it is because the mind and the motivation in that whole thing failed. Recently, I had a person who was, I mean, he was willing to do the whole program. He came in and he was motivated. He heard it from a friend of his who had the balloon in our clinic, and he was very happy. He lost 15 kilos and he wanted to lose about the same. But then during the conversation, he told me that he doesn't like to listen to anybody. He likes to make his own mind. So I told him, listen, with this system, you have to do exactly what I tell you. You have to do exactly what my dietitian tells me. He said, no, well, I know better for myself. So what can happen? I said, well, what can happen is that it doesn't work as we want it to work. He said, well, I don't care. I mean, I have the money. If I don't lose enough because I want to drink, I want to eat, I want to do whatever I want to do. So if I don't lose the 15 kilos and I will lose like 7 or 8 kilos, that's fine. I'll take another balloon afterwards. To me, that was a no-no. So it was a no. 80% what I do is psychology. So I want to understand what is the next, who's in front of me, what are the driving force, why are they doing this? If they are not doing it for themselves, then it is a no-go. You cannot do it for a friend, you cannot do it for your husband, you cannot do it because you want to save your marriage, whatever. It is not how it should be. It should be because you want to change your mindset, because you want to be healthy in the long term. Otherwise, it will not be the right journey. Although they tell you something, you would have to ask even more questions, maybe even tricky questions, repeating some questions to see if they are consistent in their answers or not, to know if they're really motivated to do this or not. Because this journey there's ups and downs, and you have to accept that. If you cannot accept it and you're going to feel sorry for yourself, it will fail. At some point, it will fail.
So really wise words there about patient management, and I would like to take the opportunity to thank all of our KOLs who joined to give us this feedback and experience during the webinar. So a big thank you to all of you for sharing your experience with us. A big thank you to all of you for attending. Just before we go on to answer some of your questions, just to wrap up a few key points to keep in mind. So Allurion have now distributed over 30,000 balloons and patient satisfaction remains extremely high. And you need to think about investing in explaining the program in detail pre-procedure to ensure that the patient understands exactly what part they play in the success of this program and equally what to expect. The first week is really critical to maintain patient satisfaction, and it's imperative that we keep constant proactive communication with the patient.